All right, welcome everyone. This is the second in our series called Nip Livestock Disease in the Bud, Create Your Own Contact Tracing Program. And today we're addressing producers of sheep. And our plan is to have the presentation last about 35 minutes with time at the end of each section and at the end for questions. I'm Carol Delaney, Livestock Specialist in the Department of Agriculture, Conservation, and Forestry with the state of Maine, and we call it DACF for short, in the Animal Health Division. And we're fortunate today to partner with University of Maine Cooperative Extension to offer you this series. And Donna Coffin is courteous enough to be the host today and on Zoom, and she'll be recording this for future viewing. And we hope at the end of this presentation, you'll be familiar with DACF staff and Extension Animal Health staff, and that the web pages, you'll know where to go on the web pages to discover the information that we're going over today. And we also hope that you'll leave with the intention of improving the management of your livestock disease through a system similar to how they do COVID-19 contact tracing. And that's why we called it this. So let me have my colleagues today introduce themselves who are presenting. So Donna Flint.
Yes, can you hear me okay?
Mm-hmm.
It says, I'm Donna Flint. I am the Animal Disease Traceability Technician for the DACF. I also do work for the University of Maine Cooperative Extension in New York County. I look forward to working with everybody. Thank you.
Right. Okay. And then Ann.
Yeah, thank you. Hi, I'm Ann Lichten-Molnar. I'm a veterinarian. I also work for Cooperative Extension, and I run the veterinary diagnostic lab here in Orono. I also do some teaching and research at the University of Maine in the School of Food and Agriculture.
Sorry about that. Our dogs here, border collies and such. Okay, so I'm going to continue on. And Donna Coffin, could you give us some housekeeping?
Okay, while I'm going over the housekeeping, I am launch the our first poll that's just asking how many sheep you have, currently using an animal ID system, and how do you transport your animals off the farm. If you have questions that you want to ask during the time that our speakers are speaking, you can go down to the chat button down at the bottom of the screen, and that will bring up a side window. Down at the bottom of that window, you can enter your question. She's sharing her screen. You can go up view options, and you can exit the full screen mode. If we have any questions right now before I turn it back to Carol. Just so you know, I have a dog in my office and he's very quiet.
I'm back.
This is Tammy Waybor. I have a question.
Yeah.
Thank you.
Will you be able to provide a copy of the slides after the presentation?
We're going to have the recording. I don't see why not. You could have the slides too. We'll probably put it as a PDF.
Okay, thank you.
Okay. Sure. Sorry about that, everybody.
And
anyway, so
we just had one person complete the poll, but I think that is probably it.
okay. So I'm just going to do a brief intro. We thought that the current focus on the pandemic and the control of the coronavirus causing COVID-19 in humans is a good parallel to what livestock producers have already been doing actually for decades. And it would serve us to re-emphasize who the players are when you're trying to control a disease and the steps that you need to take to stop the disease from spreading, and that also just basically means you have to have something in place. for contact tracing, which I actually did a little bit this year in Maine, so I have a little experience what goes on. The parallel is federal CDC provides information about the disease. So in this case, the USDA provides information about disease and has rules about controlling it, which we'll talk about. And two, they empower each state. And in this case, back to this humans, the CDC empowers the Department of Health and the local state CDC and the healthcare systems to enact what you're supposed to do when you have something, and to monitor the disease and try to limit the spread by all the protocol. And so in the state of Maine, we have the Animal Health Division in the state, and we also have our counterparts at the University of Maine with Diagnostic Lab, and also any veterinarian in the state is involved. So these are the players it takes to control disease. And three, in humans, the infected individuals and their contacts need to participate in controlling the disease. So when somebody tests positive, a contact tracer will talk to that human and say, who have you been in close contact with? In the case of animal health, we will talk to the farmers and say, do you have records of where your animals have been? And we also have to have animal identification to verify that. So, it's it's based on this interplay between producers, individual animals and state people, and then all the way up to federal. And I'd like to keep this in mind, these parallels, as we go through this presentation today. So I'm going to introduce the beginning of what we call animal disease traceability. And it's to prevent animal disease from spreading out over the United States like foot and mouth disease did in Europe. And the purpose is to use information about the movements to limit the spread. I'll also say that the USDA is very adamant in that it's not just control, restrict. We want people to be able to move their animals in normal commerce. So if you can control the disease, you can have other people with healthy animals move their animals for sale. So animal disease traceability ADT is a USDA program. So just like I said with the CDC, it's managed federally and it's implemented throughout the states. And they passed a rule, doesn't seem that long ago, where you have to have identification and documentation, like health certificates from veterinarians, to move them across state lines. So this is really important to control disease. Otherwise, if animals just flowed freely, they get sick in one state, it could have started another, and you'd have a pandemic. So you can find this information on the USDA website. Okay, it's actually called ADT, Animal Disease Traceability, where you can find all sorts of information. My people are in the way, so I can't see, but then the other is on our department's website. We have our own ADT program page where you'll get the information of how we implement that here in Maine. And one thing you can do, so you identify animals, and we'll go into that, but you identify where the animal is, and that's called a PIN, premise identification number, or PREM ID is very common term people use. And this is, it's unique to the location where your animals are. So you get this for free, and we'll explain that, why and how you do that. And it's assigned to a location. Correct me if I'm wrong, Donna, but it doesn't, if you sell your farm and go to another place, it stays with the original farm. Is that correct, Donna?
Yes, that's correct.
Great. So this is all part of the identification. So of locating where your animals are and the movement. Okay, so in components, we just said, traceability is identification of animals, and that means ear tags, and each species has a requirement. And the federal government are the ones who have come up with this. There's discussions all the time now on what type of ear tags, what qualifies. And then the second component, we talked about animal movement, and that's the contact tracing component. Which animals have been exposed to disease, and that way, which have not. Now, if you're keeping records and a neighboring farm has the disease, but you've kept records, you've practiced biosecurity, there are animals identified, that will eliminate you from the group that's infected, and that will allow you to then sell your animals. So it's important as a protection, almost an insurance measure for yourself in order to sell your animals. Now, right now, there are many types of ear tags that you can get, and but the future really is electronic documentation, so that you can read an ear tag on an animal and you can get all its records. And that not only is useful for disease tracing, where this animal came from, where it originated, but also production records and health records. Okay, so today's topic is sheep. And whether you like it or not, all sheep and goats in the US automatically participate in the National Scrapie Eradication Program, and is specific within animal disease traceability. It's a fatal disease and it's known worldwide. And because it's so significant, the federal government decided, USDA decided it needed to be eradicated to improve production and not to infect other flocks. So surveillance has happened since 2003. And because of this, the samples that they've taken at slaughterhouses have been, of positive cases, have reduced over 99%. So it's sort of like COVID-19, follow the practices, survey, do contact tracing, keep testing, and you hopefully reduce the number of positive cases. And sheep and goats have to be ADT compliant. And that means they have an identification that's official and that connects it to their farm of origin. Okay, so not only bangs. So it's trying to trace where the diseased animals are, where they've been, and how to respond, exactly like contact tracing. And we'll talk about the response too. Now, what I'd like to do today is talk about disease that isn't of national concern, but it's definitely of concern to producers. It's called caseous lymphadenitis. You don't have to report it like some of the other diseases like foot and mouth, but it's really important to you. And so we're going to talk about, Ann Lichten-Wallner is going to talk about what it is, and then we'll talk about biosecurity about it. However, again, I'll just reemphasize identification of live animals. If you're purchasing animals and they're ID'd, you get health records, history of treatment. That is so important, not only your farm, but buying from another farm. And then there's a certificate of veterinary inspection. When, say you bought a flock or some animals across state line, that veterinarian should do a complete health review, evaluation of the animals coming, and that should help ensure that these animals will be healthy going to your farm. If you don't have any history, how are you going to know what you're bringing in? So with that, I'll let Ann start her presentation. Oh, well, are there any questions, I guess? And not so far, okay.
We have one. CL is from Nana Kennedy. CL is, I believe, covered in a biosecurity panel. What else? And does this work instead of a vet check?
Carol, I can take those questions if you want.
Yeah.
Okay, great. Can you guys hear me okay?
Mm-hmm.
Great. Okay. Well, and then Carol, I'll just ask next for the next slide. If
Right.
so, okay. So yeah, we can go next. And hi, Nan. Nice to see you. So yeah, indeed. The biosecurity panel that Washington State University Veterinary Diagnostic Lab runs, it does carry, it covers CL, and then it covers OPP, which is ovine progressive pneumonia, which is very closely related to CAE, which is caprine arthritis and encephalitis virus, and then Johne's disease. So in other words, it's actually applicable both to sheep and to goats as a good biosecurity screening panel. Does that work instead of a vet check? You be the judge. It's wonderful to have that. So let's go on to the next slide if we could. I want to first say a shout out to Northeast SARE that funded the study, and it was really helpful to us and to our regional producers because it helped us put a finger on caseous lymphadenitis, so CL for short. And it's not a reportable disease. It used to be. Here in Maine, and it was rare, it was reportable. People felt like, okay, well, we'll just, anytime this shows up, we'll make it required that the state vet know about it and that they put a quarantine on the farm, and then we won't have it anymore. But what happened is it began getting more widespread. I don't know what actually made that happen, but around the time that I came here in 2008, there had been a bunch of alpacas who had died because of CL, which they probably got from being co-housed with some sheep who were kind of getting by without, you know, being terribly ill from it. It's thought that it entered the United States coming northward from Mexico a number of years ago, I would say probably 40 years ago or so, and then, you know, kind of making its way northward. But at any rate, it's commonly known as cheesy gland, which, we have a chat note that they were housed with goats. Thank you for that. Bad news. Anyway, it's commonly called CL, cheesy gland, and that's because it's a very chronic, deep-seated bacterial infection of the lymph nodes. And the bug that causes it is a bacterium called Corynebacterium pseudotuberculosis, so kind of like tuberculosis, which is a horrible disease of a bunch of creatures. This is not a strain of tuberculosis. It just causes deep-seated dry abscesses, kind of like you would get if you had tuberculosis. It stays in the immune system, so it stays in the lymph nodes, and it travels around inside the animal. It doesn't always show up where you expect to find it, but it can cause skin abscesses, or it can cause internal deep abscesses. And it basically can be spread from animal to animal, but it has to kind of get through the skin, or it can be inhaled if animals have it in the lungs and they're coughing it out. And so animals can get it indirectly, kind of like we would be expected to get COVID from droplets and things like that in the air. Unfortunately, it sticks around in the environment, and then also the test, there's a blood test for it, and that test is for exposure to a toxin that it produces. And there are vaccines available, they're not great. Next slide, please. We actually worked on trying to develop a vaccine, but didn't get very far. It's not an easy target. But this is what it can do inside the animal. This is actually a picture of a goat. I took these pictures at our necropsy lab, and you can see that where we have the notes, this is on the left, we have the thorax, the chest of an affected animal that died and was sent to us, and I've rolled back the ribs. You can see them there. And then there's that smear of something that looks like strawberry jam or something, and that's all inflammatory tissue from this chronic, nasty bacterial infection of the lungs. And then over on the right-hand side, you can see that small yellow lump of stuff that is deep inside the lungs. And that's the cheese-like material, caseous material, that gives the thing its name, caseous lymphadenitis. Let's go to the next slide, please. Disgusting. Anyway, but so again, it has to get directly inoculated into the new host. So that can happen from a biting fly. It can happen from a stab wound or a cut. It can happen from contaminated shearing equipment. going from one animal that has it, picking up that pus and getting it into the next animal by tiny abrasions on the skin. We have wonderful shearers. Mostly they're very, very careful and don't cause this kind of problem, but it's a possibility. Down under in, I think it was in Australia, where they found that the use of sheep dipping bats was spreading it all over the place a number of years ago. So there are a lot of different ways that they can get it. And again, I mentioned inhalation. If you have a sheep with a chronic cough, it can be spreading it around. We think that if animals have abscesses in the udder, which can occur, that it could get into the milk. And it probably does not get passed from mother to lamb within the uterus. So, great. And we'll get to the chat questions, but next slide, please. I don't want to get too far behind here. Okay, great. So, yeah, again, vaccines, they certainly help prevent abscesses, which can help contain it if you know it's on your farm. They don't prevent or cure it. And it becomes chronic, and animals can become somewhat immunosuppressed because of the toxins that it produces. Again, we said it hides out, gets throughout inside the animal, so it's not like you could pinpoint it to one area. And unfortunately, in the lab, I can kill it with a lot of different kinds of antibacterials, but in the animal and in nature, it is much harder for those antibiotics to reach it. And so if you really go for it and use some nasty combinations of drugs, you can have some effectiveness in the animal, but remember, we're dealing with food animals here. And so things like rifampin, things like gentamicin, some of the drugs that are a little more high-powered aren't going to get used very often in food animals. It's not allowed, and it would be expensive, and it's just not a good solution. Next slide, please. Thank you. Again, it can last for a long time in the environment, and especially when it's in the form of like dried, exudate. So one of the things that we found was that we had some sitting around in the lab in a little sealed snap cap vial. We just left it in a protected area on a bench counter in the lab, and just let it sit there for 2 years, and then went back to it. And we were able to culture live CL out of that material. So it's quite durable in the environment. You don't want this on your farm. So why are we talking about it here? Again, it's not a regulated disease. There's no federal program about it. But if you know, if your animals are identified and you can test for it, then you have a way of identifying the animals that have been exposed to it or are likely to have it versus those that don't. And if you test for it and use good biosecurity, then you have a chance of having a CL-free herd, flock or herd if you have goats, which is a worthy thing to have. Next slide, please. Thank you. So we were doing that testing here because courtesy SARE, we were able to devise put the test together, which took us a while to do. We had the same test as Washington State University was running. We aren't running that at this time because we had a problem with some of the equipment in our lab, actually. And so the toxin, we weren't sure that the toxin was good anymore, so we just stopped doing the test. But again, Washington State University is still doing it. Again, the vaccines, the other thing about the vaccines is the vaccines, if your animals are vaccinated, they will test positive. So then you lose the advantage of having the test available to you to screen your flock for positive animals. So, so we suggest testing them periodically and culling the ones that are seropositive. And coming up with a strategy that works for your farm. And next slide, please. So So again, this is old material. It's over 5 years old now. So we hope that the situation is better. It certainly helped us to get people to think about and talk about this disease. But at the time that we ran these studies in 2014, 2015, we had 50% of the farms had at least one positive sheep at the first test that we ran them. And then so 22% of over 700 sheep that we tested at least once were CL positive. So that was not minor. But there were 8 negative farms in the study that stayed negative. And so then most of the people acted against this disease. They were interested, they took part, they culled or isolated positive animals with a plan of, creating a separate flock or having a negative flock. In goats, again, we tested 19 farms and over 450 samples. So again, about half of those goat farms had at least one positive animal, and then 8% of the goats tested were CL positive. So not, at the time, that's quite a lot, of that disease in our area. Could we go next slide, please? So having your animals identified helps you control which ones are which. You can imagine that, if you just don't have a good grasp on who the spreaders are, that you lose the effectiveness of this tool altogether. Using high biosecurity within your flock and around your flock is really important. I know that Donna Flint, I think, is going to talk some more about biosecurity, but you need to know how to impose an effective quarantine on your farm. And having animals be able to touch noses through a fence does not constitute quarantine. And we suggest that if you really want a CL negative flock, that you are going to want to test animals when they come into your flock and prior to release from quarantine. So that's, hopefully about 2 months between the time, like say you buy some new animals, you bring them in, you got them quarantined away from everybody else, and you're going to test them at the beginning of that time. And at the end of 2 months, if they're healthy and they test negative, then bring them on in to join the rest of the flock. But if they're positive, you got to make a hard decision. Are you going to keep them or not keep them? And you may want to cull them if they're positive. But if you're going to keep them, then you're going to try to have 2 separate flocks. And I've talked to some people here in our state that have in the past tried to, and successfully did, reestablish a negative flock from a positive flock with very careful steps, and it was not easy. So if you want to talk more about that at some point, I'd be happy to talk to you about it. Carol, could we go to the next slide, please? Thank you. So in general, don't buy problems. If you think that the animals are coming from a flock with a problem, then you should ask to test the animals before you purchase them and take them home. So if you're thinking about adding to your flock, think twice. Do you really need these animals, or could you get by without? And then, is the source flock CL negative or CL positive? Were they CL vaccinated? Ask that question, because that's going to change the outcome of any testing. If you think you're going to buy animals from a CL positive flock, I would suggest you don't. But if you do, then quarantine and test them at entry and 2 months after. And then if they're reliably negative, then you may want to bring them into your flock. Next slide, please. So if they're CL positive at the end of the quarantine, probably a good idea to just say goodbye to the sheep. If you do decide you're going to keep them anyway because they've got some great, wonderful genetics you really, really want, then you should sequester them. And if you have a ram, now maybe you want to use artificial insemination, collect semen from him, but that may be more trouble than it's worth for you. So that's not a minor thing to do. And it's probable that it's not passed by the semen. But if they're CL negative, again, at the end of quarantine, add them to the group and then keep good biosecurity. Next slide, which I think is just my thank you to the many people and Sarah that helped us do that. And then I will go to the chat, and there was another question that if it came from Mexico, if CL came from Mexico, is it safe to assume that biosecurity panels and appropriate quarantines are part of the protocol for importing animals or genetics as semen, for instance? Okay, well, that's an excellent question. Certainly those are good things to do. Is there a requirement that you do so? A CL specific requirement? No. But for up-to-date recommendations and requirements as far as importing animals from other countries, I am not the state vet, but you would definitely need to be talking to USDA and also to our for information that's specific to our state about importing animals into Maine. And importing animals from other countries has another level of regulation on it. Again, I don't do that kind of work. Unfortunately, on today's call, we don't have one of the state vets, but probably on future calls we will. And I think that is it for my portion of the talk. So Carol, thank you very much. I'm also hanging around afterwards if anybody has any questions that they want to follow up with. I'd be happy to answer them later.
Right, so I'm not a veterinarian, and Carolyn Hurwitz is not here today to answer that, and perhaps Donna can later, but each state is in charge of regulating the importation, and the producer works with a veterinarian, and they have to fill out forms. So that, I would believe, be the point where you would know what's being regulated in terms of importation of animals. Okay, so we're gonna have Donna Flint talk about identification.
Everybody's favorite topic, how do you identify your sheep legally? So there are official tags. What makes them official is there is a US shield on them. And there's also a statement on both front and back of the tag that says it's unlawful to remove. The coding on the tags are state identification. The first two letters identify the state, and then it would be followed by a letter. Example for Maine would be ME and then X, and then the next four numbers will be your flock ID. Example is 1, 2, 3, 4. So a complete flock number would be MEX 1, 2, 3, 4. Next slide. So where do you get your scrapie flock identification numbers? You have to call our, the USDA office in Sutton, Mass, and the phone number's right there, and you'll talk to Gail. Originally, you could get plastic tags or metal tags. Right now, you can only get metal tags free. You have to order your plastic tags. So to order these official tags for either sheep or goat, you'll need a scrapie flock number. Gail can give that to you immediately when you talk to her, and then the vendors will confirm your flock number when you order your tags. And we do have a list of approved vendors on our website. The easiest way is to purchase the animals with the tags. And remember, it's unlawful to remove. So if that animal has a tag and it says, you know, the state is Minnesota or whatever, that tag stays with the animal, even though it's in Maine. It does stay with the animal for the rest of the animal's life. And then you do get a flock book, a pocket flock, scrapie flock record book that you can keep in your pocket, and you can make notes on your animals. If you happen to, an animal does rip a tag out, you can document that the tag was ripped out, and then you can put one of your own farm tags in it, but that has to be followed through with the animal as well. Next slide. And these are just bigger pictures of the official identification. So on the red tag on the left, you have the male part and the female part, and then you have, which is hard to see on it, it says unlawful to remove below the 1, 2, 3, 4. And on the female part, it has the USDA, the US shield on it. So that the XX2373 would be the flock number, and then the 1, 2, 3, 4 is the individual animal number. Now you can get more elaborate tags that you could have your farm code as your flock number. So it would read differently, but it's basically the same information. We can, if we find an animal on the side of the road, a body of an animal, I should say, that someone has destroyed and left on the road, we can look at that number and figure out where that animal originated from. And I believe that's all I have for the.
Are there any questions at this point? Okay, everyone knows this. All right, I'm going to jump right in.
have a
And, oh,
question. What if the animal loses the tag?
If the animal loses, like I said, you have your flock record book. If the animal loses the tag, you document that the tag was torn out, and you can retain a tag if you feel better. But you would then replace it with one of your own farm tags and make a note that it was replaced on what date.
so replace with an official tag or just?
Yes.
Yeah, okay.
Your scrapey flock tag.
Okay. Right. Good question. Okay. All right, I'm going to jump ahead. So I'm going to continue to talk about ADT program, and record keeping is really important. So use the information. For example, if foot and mouth disease came in your area and there's an area of control around that flock that might have it, and if you were in that area of control and they went to you and you had all these records, official ID, they know where your animals went, if it was possible, your animals would be free to move. So that's the advantage of it. It's not to restrict you, it's actually to help you continue to sell your animals and move them around. Okay, so what should you be recording? Obviously, animal ID, official ID. Often people have farm IDs. I would say the number and identification of animals in each group. You usually group animals, you know, your yearlings, your lambs, your breeding flock. Know who's in each group. That is very useful, because if for some reason they all got out and ran to the neighbors, you know which animals were in that group. That's really important as well. For yourself, the age and the sex, that often determines whether they need certain types of identification or a veterinary inspection. And for yourself, the origin, obviously, which farm, and then the breeding is helpful for you. Now for production records, you know what you want. If you have fleeces or how many lambs, things like that. But animal weights are really important in production. It's also helpful for veterinarians to know what they weigh in order to treat them. And then when you cull an animal or it dies, why? Why are you culling it? Why did it leave the flock? That's really important. And that is basically, I've jumped ahead to medical records, the treatments they've received, the test results. For example, Anne talked about vaccination. That affects, if they were vaccinated, if you're buying an animal that was vaccinated for CL, that is going to affect your interpretation of testing and what you do with that animal. So that's important for you to share with others and also to ask for this information. Okay, what were the test results, positive, negative? And then again, if something dies, why did it die? As far as you can tell. Okay, so basics, quick basics on biosecurity, which I think this group is aware of, but I called it to parallel our title, it's called Nip, Tuck, and Muck. So nip means we want to nip in the bud. So that is controlling traffic on your farm, whether it's equipment delivering things, humans, livestock, other livestock, or wildlife can bring in disease. So you want to you know, label areas and let people know they can't go or what they should do before they enter. Some of you show, there might be some closed flocks here, people representing that. That would be ideally the way, although humans and wildlife can still bring in disease, but limit the off-farm travel. However, people show, and you will just have to have a protocol before and after when they leave. And when they come back. There's a good extension bulletin and page. If you can search on the UMaine Extension small ruminant page on how to bring your animals to shows. Okay, tuck. Okay, isolation of animals new to the farm, just like Anne spoke, or those of your own are showing illness. I didn't really know this years ago when I was an extension agent, but it's best to have those pens, isolation or quarantine pens, away from the barn. Have their separate place for them. Or try to have a solid wall and a separate entrance, because you do not want sneezing animals, or you don't want to share water, things like that. Now, quarantine we've written as minimum 21 days, but obviously for the different diseases, it's for CL, it's 2 months. So we came up with 21 days, but you really should talk with your veterinarian on how long that should be. And then muck, you want to make sure that animals in quarantine or sick animals, that you have a protocol for foot baths, walking through yourself, and then how to disinfect these pens afterwards. And then if an animal dies, how do you dispose of it? The state of Maine promotes carcass disposal by composting. And so you wanna, that is a whole nother thing you could take on. If you don't have it, what's the best way to do that with any animal that dies? And then in general, it's what you all do. A low stress environment will promote health. So if an animal is exposed, and so bedding, water, fresh air, I think are the most important things in terms of promoting good health in an animal. Okay, so as a recap, to prevent, if you haven't done it yet, the first thing you could do is create a premise map. And you can do fancy, you can do Google Maps, and then get a photo of it and draw where people enter, where animals are, and then, or you could just do a hand drawing. And then what's the major point where the highest risk is? That's what you should do. And then I would say develop your isolation area. Those are the two biggest things, if you haven't done it, to accomplish this year. And then, you know, record things, even if it's on the calendar, when the animal's moved. For example, you might move animals to another farm just for grazing or something. Okay, then the other thing is, as I talked about grouping animals, I've taken care of animals before for other people, other flocks, you know, they're going away for a few days, and they broke out, and then I got them back in, and I said, I don't know how many there are, so I had to call them. How many, do you have 45 ewes? You know, and they're like, yep, I think so. So that really helps to know the number, and that's the head count. And then obviously you always go through and look for illness. And that's another reason why to check. And then start recording when you noticed it. The animal could have been limping for a while, but just record when you noted it. You know, maybe I was taking care of your flock for 3 days, and then you came back and this animal was limping. It might have started earlier, but that's when you start, and that's write it down, and that's when you start talking with your veterinarian. Okay, so again, separate these ill animals or new ones in, communicate. All right, so if other people are taking care of animals, like myself, take care of your flock as a farm sitter, then explain to them they've got to take care of the sick or quarantine animals last. Maybe they would put on separate boots or coveralls and wash in between. And then discuss it with your veterinarian. I'm jumping ahead so we can get done here and you can ask questions. So here's the conclusion. Contact tracing with humans is virtually the same as animal disease traceability. You have to start with animal identification. And we talked about that. Link that to record keeping. Continue to build your biosecurity plan and make steps to enact it. Just choose 1 or 2 things each year to improve or to start. And then have an established veterinarian client-patient relationship. That's so important. So when you do have an animal, you're not sure what to do, maybe it needs antibiotics, then if you already have that relationship with your vet, you can call them, send them a picture, and they probably can help you out quickly. And then contact staff at the Department of Agriculture, Conservation, and Forestry. And also you can use Anne. She can explain how she can help you at the University of Maine Vet Diagnostic Laboratory. So we want to take questions now. And then I'll give you, there'll be a couple slides at the end with resources to help you enact this, and then our contact information. So are there questions?
We did have some comments that sometimes it's hard to tell what the cause of death is, even with a necropsy. And sometimes there might be a run of mysterious deaths that would take several necropsies, and a grant might be great to provide an educational tool for farmers down the street.
I do know, I don't know when she'll retire, but Tatiana Stanton is the goat and sheep specialist. She might just be goat, but she definitely knows sheep at Cornell. And they have a lot of resources in their website on doing necropsies, because Dr. Mary Smith, who helped co-author Goat Medicine, has done, they used to have in-person field days, and she would actually show a necropsy. And it is true though, I've done necropsies and I've talked to veterinarians, you know, just general ones, and they're like, at least 50% of the time in a field necropsy, you cannot tell why the animal died. So it is true.
So
Go ahead.
Okay. Oh, I was just going to say, yeah, they're really good. And one of the things that we've been able to do, and we here at Maine, is that we now have a necropsy viewing room, so we can actually, well, once the COVID things are relaxed a little bit, we can have a client come up, they bring an animal up. I've done this with a group of different groups of people over time, but they actually, the farmers they're not in the same room as I'm doing the necropsy, but they're next door with a viewing window and cameras in the ceiling, and I can also be talking to them as I'm doing the necropsy. Yeah, it's really, I think it's really helped. I know that the cases where we were able to do this last winter before the big shutdown, the farmers were really appreciative. And just as you cite, oftentimes doing a field necropsy is what you might have to do because you can't get the animal in, or the resources aren't there to do it, or it's just, you're there, how to basically open up an animal. And there's some things that you can tell, but a lot of them you can't. It's much more subtle. So that's why having a diagnostic lab around you. Ours is a small diagnostic lab, but we can do a lot of great stuff. Cornell's is really big, and they've got all kinds of people. We use them as a secondary resource a lot of times. Bits and pieces of things that we necropsy here may be sent to Cornell. They're wonderful people, and they're a very important regional resource. But I do find that almost always, not always, but almost always, there are some other factors that are very much under the control of the farmer that are present, contributing to the cause of death in animals. Parasites, and nutritional and housing issues. So I deal more with poultry than I do with sheep and goats, although I definitely deal with both types of species. And it's perhaps more obvious with the poultry, but we have some phenomenal parasite problems here in Maine. And we're not unique, but it is very easy to let those things kind of get out of hand. So those are always underlying management issues. And the reason I mention it is just because as farmers, you guys, you can do something about those. Good management is good management, so.
Are there any more questions?
We've got a couple, but Carol, what I think I'll do is launch the poll. So while
Yes, thank you, yeah.
responding to questions, if folks have to leave early, at least they'll have a chance to.
Yeah, if you guys would fill out the poll, that'd be awesome.
And we have a question that needs a clarification. So if a sheep loses an official scrapie tag, do you replace with another official one or your own unofficial tag?
Hey, Donna.
Hi. So the ideal would be to replace it with your official tag. If you're keeping your farm record books and you know that that animal lost its tag, you would record that the tag came out. You could put a farm tag in as long as that animal does not leave your farm. But as soon as you want to either bring it to a fair for exhibition or for a show, As soon as you load it in your truck, it should have an official ID tag back in its ear. So in order to save money, sometimes people will just put farm tags in until they're ready to ship an animal or bring it to a show, and then they'll put the scrapey tags in.
Okay,
And
and-
some folks are having trouble seeing the poll.
oh, I can't see it.
Cannot.
I can't, but I clicked it away, so maybe it's,
Well, I can end it and start it again. Maybe that will help. Oh, I guess people are seeing it now. Okay, we had another question. Are animals protected by HIPAA? And would be great to know when they are happening, if anyone wants to. Oh, when necropsies are happening, so if anybody wants to come and view. So that might be something Ann could do, but a lot of times you get someone calls, they bring an animal in and you do it right then, right?
Yeah, that's true. We do. But what I think I appreciate the question, because one of the things that we would like to do is we're working on some videos. I'm actually doing a poultry necropsy video, but we're using it for our animal vet science students as kind of a trial audience this fall. And then we're going to do some more videos about field necropsy. Years ago, I did a triage necropsy class that was enthusiastically received, just trying to show people, okay, here are some things that you probably really can tell out in the field that you should look for, and versus the more subtle things where we're going to have to do some other testing. Does that kind of answer the question? However, I will say as well that just as Donna pointed out, most of the time, not most of the time, but a lot of the time, like Friday afternoon, we have a phone call from somebody who's got, like, say, a huge flock of turkeys, and they've suddenly had some deaths. And so we hustle to get everything we can done on Friday afternoon, like immediately, because they need an answer fast. So there's no time to let people know, even our students, that something's going to be happening. We try to capture as much information with photos and documentation so that we can tell the narrative later for teaching purposes. For farmers, probably the best thing is for us to do things like workshops, so have a video collection. But we've held these workshops with our necropsy viewing room in mind. We've held these workshops over the last number of years with the wildlife folks, so IFNW, wildlife biologists, the warden service and things like that, so that they can learn something about doing necropsy in the field safely. So that's been a kind of a similar thing. But yeah, for farmers, it might be something people would want to do more.
And years ago, we did one in the old Hitchner necropsy lab, and it was during the winter. So when the farmer had a sheep die, they packed it in a snowbank. And so that gave us a few days to alert folks that, go up at this time and at this place. And they were able to do the necropsy, and farmers really appreciated that.
right. Are there any more questions, or?
Another one, can we assume that RFID with your 840 number suffices for a scrapey tag?
No, you cannot assume that. 840 tags are strictly for cattle right now. They're implementing it up through 2023 is going to be, all cattle have to be transitioned to 840s. And then the swine will be the next group of animals that use 840s. A scrapey tag is totally different. They do make RFID scrapey tags, but you do have to get, it's a different pattern of coding on the scrapey tag for the ID.
Wow, good question. All right.
And from the registration, there was a question when to use Ovitet B, 10G, or other penicillin. And I think probably you need to contact a veterinarian.
Yeah.
Yeah, the rules have always been that if there are labeled drugs that you can get over the counter legally, and on the label it says for use in whatever species, in this case sheep, for the treatment of pneumonia or whatever it is that, it would be a specific condition, and then they give a dosage and withdrawal times on the label. And if it's on the label, then that means that it's okay for you to buy the drug and use the drug for that reason in that species, following those withdrawal times. However, if you're kind of just making it up as you go, you can't find the thing that you want, or you think this should work, or you have it but it's labeled for swine and now you want to use it in sheep, you need to talk to your vet. You need a prescription and guidance on how to do that, on how to use that drug correctly and safely. And there are some drugs you cannot use in livestock. So this is the kind of thing where it's great, although what I do is I run the lab and I can give some general guidance as far as disease goes, and our state veterinarians have a regulatory role to play. You really need a farm vet. You need to find a veterinarian in your area, and the state vet has, over the last couple of years, made available online a list of vets in Maine who will go do farm calls and see farm animals. So that's available to you. You can contact the state vet or contact us at Cooperative Extension, and we can get that list to you. It needs to be updated periodically, but we updated it last year. And you will probably be able to find someone who can help you, who will understand what your animals need, and work out something that, so that they can help you with these kinds of questions.
Great, good answer. All right, is it time to close the question and answer period?
There's a follow-up on the RFID sheep tag.
Okay.
Someone ordered with the Scrapie premises number and was told it was sufficient and would eliminate double tagging. So, is that correct?
I'm not aware of that. You wouldn't double tag anyways. You only ever use one official ID in the animal's ear. And I know that 840s are strictly for cattle right now, but you can probably order anything you want and they'll sell it to you. They have new electronic tags that are scraping compliant, that are small, so they're not getting caught.
Mm-hmm.
And there was a question about saving the chat. If you have the chat open down at the lower right, three dots, you can hit the three dots and there's an option to save chat.
Right. And I'd also say just Donna Flint is a great resource. So if you have more questions, she'd be great to contact about that.
And we'll be sending you a follow-up email with a link to the video once we get that posted. Right. And we can have a copy of the PowerPoints and the resources.
All right. And I'll just quickly go over the resources to finish up here. And so I looked through, so national and state resources for biosecurity plans. So this Secure Sheep and Wool Supply Plan was just finished, and combination of funded by USDA, and it's for foot and mouth, but basically shows what we talked about today, the whole gambit from producers to vets to packers to state officials, how it would look like and how to prepare for foot and mouth. And also they have templates for your own biosecurity plans. The other is official animal ID, and at the main our DACF website, we have 3 videos. What is official ID and how do you put it in your sheep's ear? And we also, if you don't have a veterinarian, we list large animal vets who say they treat animals. And sometimes there's it's an Excel spreadsheet, and sometimes there's comments on which animals they treat. Then the other would be a really good website for biosecurity. Whoops, I don't want that. Okay, is Healthy Farms, Healthy Agriculture. They go through, they have training, so that's just a good one-stop shop. Also Secure Sheep and Wool up here and Healthy Farms, they have lists of disinfectants you can use. Record keeping, I was trying to find some good examples, but you know, if you go to the Maryland Small Ruminant website, she has 20 different programs, software, apps, books to use. So you have no excuse. And here's our contact if you would like to ask us questions. And thank you very much for attending. And our next webinar will be similar, but it will cover goats and a goat disease. And I hope you have a good rest of the day. Thank you for attending.
Thank you, Carol.
Thanks.
Great seeing everybody.